Good morning, Griffins.
This week, we're going to be talking about essential workers.
Today's April 13th of the year 2020. I'm Santiago Ortiz.
I'm Kayla Miley, and the legend starts right now.
Social distancing, and that's an aggressive measure that's taken to help contain an outbreak or slow its spread.
It's all about staying at home.
Nothing is normal this year.
There are some signs of hope now in Spain and Italy, where the rate of COVID-19 infections and deaths is slowing.
This is rough. This is a struggle.
Yeah, it has been. It's been life-changing.
They are 3 of 1,200 nurses surveyed from 50 states in the last 2 weeks.
Many of the people you see leaving their homes are essential workers, but what exactly do they do?
Due to how brutal COVID-19 has been, the state has mandated everyone who is not an essential worker to stay home. These essential workers show up to work every day risking their lives to keep our communities in motion. Even though they know they are not immune, they are still willing to do their duty. With the fight of COVID-19 still continuing to grow, we want to thank and applaud these workers for their courage and bravery. With these heroes on the front lines, you too could be a hero by staying home and social distancing to help prevent the spread of COVID-19.
Trying to adapt to this new lifestyle, some Sickle students are finding it hard to balance school and working during the virus.
During the coronavirus pandemic, many students at Sickles have been laid off of their jobs because of them closing. But there are also students that are still working because they are labeled essential workers.
It's hard. I mean, there's a lot of people that come in with masks and gloves on, and some of them are coughing. So, you have to be careful of who you interact with, how close you get with customers. And I don't know, it's just a weird world now.
Seems like we should be closed because you see people coming in to pick up stuff and they have their gloves and their mask on, and it's people ask, why are you open? And it's because we still get business, and it's just kind of scary because you never know what could happen. You never know who comes in the store and what they could have.
I've had to rearrange my schedule because I've been working more hours and I have a lot of schoolwork to catch up on. So right now I have 4 classes that I need to get my stuff done. But I have limited time to do my homework, so I only have a day to do all of it at once because the rest of the week I'm working, so it's kind of hard to manage my time.
I kind of have to balance what I'm going to do before I go to work with my work schedule, but our boss is pretty lenient on letting us do work when we're not busy in the back and stuff like that, but I know other people working don't have the same fortune as I do.
A big thanks to all the workers out there keeping essential businesses open. This has been Peyton McBrien from The Legend.
With all the negativity surrounding this time, some of us need good news. Well, we got your segment. Here's the good news of the week.
Efforts to flatten the curve and people helping members of our community continue as researchers make new discoveries. I'm Miranda Watkins from The Legend, and here's some positive news that will hopefully brighten your day. Although staying home all day is no fun, recent numbers have revealed countries in Europe, such as Spain, Italy, and France, have shown a decline in new coronavirus cases. These studies are showing that self-isolation is working to slow the curve. Steel Tie Spirits in West Palm Beach, Florida has shifted from their normal distillery operations to make hand sanitizer in this time of need. The distillery is donating their sanitizers to hospitals, first responders, and retirement homes. The hand sanitizers that aren't being donated is are being sold to the public to ensure the distillery can still operate while providing income to its workers. Shifting from coronavirus-related news, a new blood test has been created that can help detect at least 50 kinds of cancers. This breakthrough discovery by researchers at Dana-Farber Cancer Institute and the Mayo Clinic would allow doctors to detect cancer in its early stages and pinpoint where the cancer is in the body. Although these tests are only open to the current clinical study as scientists refine the tests, this is certainly something to look forward to in the future. Until next time, I'm Miranda Watkins from The Legend.
Amidst the quarantine, many businesses and schools have decided to let their employees work from home.
These employees now have to learn how to balance their work with having their kids at home.
Due to the coronavirus pandemic, workers who are also parents have had to considerably alter their schedules in order to balance work and their kids.
Trying to manage making kids happy in the house, my own children, with getting grading done and lesson planning and Zoom meetings with other teachers. It's just all new, trying to manage a whole new schedule. I had the schedule set for me when the bell rang period by period at work. But now none of that exists. I've got to organize my own time, which I've never done in my life. I've always been in a school setting where time's already organized for me.
So what I do is I take my kids to my office. So we wake up in the morning, we get ready, and then we gather all of our materials, and then we go to the office. And the first thing I do in the office is I set everybody up in different computers so they can start their schoolwork. He's doing some work in the morning. I get ready for my work. I sit next to him in a different computer. I do my work. As a parent, you have a different relationship with your child than the teacher does. So for a younger child who is used to doing certain things and having a certain reaction to mom or dad, it's a little bit more difficult for us to influence them to do the schoolwork the same way that they do it in school.
At home anymore. So trying to manage all the stuff in the house, laundry, dishes, cleaning on top of all this other stuff.
That was perfect, thank you.
Managing the education of their kids along with their work has been difficult for these parents. However, adding certain structure and schedules to their day has allowed for them to work more efficiently despite these challenges. Thanks, Griffins. From The Legend, I'm Jillian Horowitz. Stay home and stay safe.
During these ever-changing times, some people are trying to find what little sense of normal they have left.
With this new sense of normal, it may be from going to work out to going to do homework or even going out to eat. While some restaurants have closed down, others have remained open to keep their customers happy.
When it comes to essential businesses open during coronavirus, restaurants walk a fine line. Consumers need to be aware of the potential health risks as well as the safety precaution put into place during this time. For their health not only affects their family, but the workers and the employers involved in the job.
It's definitely a lot slower. They start sending people home because we don't have like a lot of people there.
We used to run 8, 9, 10 people in the morning, 12 people for lunch, and 7 or 8 for dinner. So the workforce is cut in half, but the work doesn't go away.
So there are times when there's no one in the drive-through, and we're like, wow.
It makes it about 10 times harder because not only is there more stuff to look at, because one of the things that we put in place is every 30 minutes, we have to sanitize every area that's touched.
We definitely, when we're taking orders, we try to stay like far back from the cars as we can while still being able to hear. I don't touch my face while I'm wearing the gloves. I make sure to wash my hands anytime I go inside. The people that are preparing your food are not the same people that are swiping cards and counting cash. I think when we go back to normal, we're going to keep up the same kind of like diligent cleaning procedures and making sure we're wiping everything down. But I think we'll be able to open the inside back up again and start to get normal.
And this now just increases the awareness from everybody. Like, if you've never heard people, before, like tell, hey, you don't have, gloves on, this, and so like it will increase the awareness, tenfold in the restaurant industry.
When you pick up your phone to call delivery or get in line for the drive-thru, remember who you are impacting and the risks you are taking. Stay safe and stay healthy. For The Legend, I'm Jocelyn Pritchard.
During this quarantine, some businesses have remained open, while others have decided to close their doors to the public. Upon their closing, some employers have made the difficult decision to lay off their employees.
Hey Sickles, I'm Jacob Key, and I'll be joined by Alex Shepard later in this video. As we all know, COVID-19, or better known as the coronavirus, has impacted this nation as a whole. Many local restaurants and businesses have decided to shut down their operations until a further date. Because this shut down operations, many workers, including students you and me may know, are getting laid off. We asked students who are getting laid off or getting their hours cut how this affects their livelihood.
How did your employer tell you that you were losing your job?
He just sent out an email telling us that the high school kids were gonna get their hours cut.
A website, and he sent out a message to all of the employees to let them know that we would be closing and things would be very different and not a lot of people would have their job.
Called them, I said I don't feel comfortable coming in right now.
How does not having your job affect your day-to-day?
I miss it, honestly. That was my favorite job, and it's a little bit less income.
I cannot pay for my car right now, and I don't have money to go buy things that I would need.
I don't get as much time off, so I've had more hours since the virus started spreading.
Do you think you'll have your job back when all this coronavirus stuff is over?
Honestly, I wish I could say yes, but since it's kind of like a random business, almost I don't know if he's gonna have the funds to pay everyone.
Depends on the kids and if they're going back to school or not.
And that's the effect the coronavirus has had on high school kids trying to work. On behalf of Jacob Key, I'm Alex Trepper. Thanks for watching.
You may have seen what's trending on Twitter. #FireFauci. Let's see what it's all about.
Anthony Fauci is a physician who has worked with the National Institute of Allergy and Infectious Diseases since 1984. He has been at a lot of White House briefings recently because of this pandemic. Recently, there has been a movement mainly on Twitter and other social media to #FireFauci. Trump, for the second day in a row, as of April 7th, has pushed for the anti-malaria drug hydroxychloroquine to be used as treatment, despite Fauci outright disagreeing with the statement, saying it was anecdotal and was not done in a clinical trial. He is currently under fire by right-wing media as a conspiracy theory to undermine the president. Yet, he's a leading advocate for social distancing and limiting human interaction, which has led experts to believe that the US's peak of COVID-19 cases won't be as bad as Italy's. This has escalated so far that former Representative Ron Paul has called for Trump to fire Fauci, calling Fauci a fraud and encouraging people to stop listening to him. This has been Evan Wilson with The Legend.
We know one thing that everyone's doing right now, and that's watching the news.
While the news has their own opinion on the COVID-19 virus, some doctors may disagree.
The media has represented COVID-19 in many ways, some more accurate than others. We got to interview Dr. Drake to see what is the most accurate.
It's kind of a double-edged sword. The media is good in one way because it gets the information out there regarding how contagious it is, how we need to be social distancing, how there's a lack of personal protective equipment, all of these things that are helpful. The public needs to know these things, but also, they could be a source of misinformation and a source of fear. People are just really scared, and I see a lot of people come in who are, they have a cough and they're just worried. I don't have enough tests. Right now at my hospital, we in the emergency department are only really allowed to test people who are sick enough to be hospitalized. If a healthcare worker is exposed to a COVID patient and displays symptoms, then we can get a test. And it's important that we do because we're going to continue seeing patients and we don't want to spread it to other patients. it's a daily struggle to go in there. It's a war zone, you know, and you don't know, you can't see your enemy. It can get you when you least expect it. You know, if you are considering going to a party and it's only like 5 people, no, please don't. Only go out to get groceries. Try to limit your exposure in the public. The CDC is recommending that everybody wear some sort of covering over their face. Something's better than nothing. Wash your hands full 20 seconds, hot water and soap. And just remember, we're all in this together, and this is going to be for the benefit of everybody if we do this. And if we just stick it out a little bit longer, it will be so much better than it could have been.
As told, please be safe to do whatever you can to prevent spreading the virus. I'm Justin Lugo, and you're watching The Legend.
Well, that's it for this week. Don't forget to keep your hands clean. This has been Santiago Ortiz.
And Kayla Miley. Have a great day and make good choices.
Bye.
Bye.